Good morning, colleagues. I'm really pleased to be invited to deliver this video message to you today. And I'm really sorry I can't be with you live. I'm actually on holiday this week and today is my wedding anniversary. It has, of course, been a really challenging year for the NHS, but also for community pharmacies, for LPCs, and of course for all of us personally. And these challenges remain as we head into these critically important winter months. We have so much to be proud of as pharmacy and medicines professionals. Indeed your response to the COVID pandemic has been of the highest order, and this reflects well on everyone. I want to say a huge thank you for all that you've done professionally and personally to support patients, families, carers, your local areas and the teams over the last few months. It's been incredibly difficult, overwhelming and a very challenging time for community pharmacies, but you've demonstrated your essential clinical role in the NHS system, as well as crucially keeping patients supplied with medicines and, as importantly, healthcare advice. But to say the least, it's not over, and I'll talk a little bit about how we need to continue to work together over the coming months to deliver for our patients. The central task for all of us this autumn is to ensure we vaccinate all those groups who are most at risk of flu and therefore eligible for a free vaccination. The annual service spec and supporting PGD for the community pharmacy flu service were published on the 28th of August, as I'm sure you know, and outlined in particular is the importance of vaccination for care home residents and staff. That service, as you all know, went live on the 1st of September. Further updates, including any developments in the relation to the COVID-19 vaccine and any funding news, will be shared as they become available. Really importantly, we need your help to ensure community pharmacy owners and leaders offer vaccination to their staff, including supporting those who are eligible for free vaccination to get one within the next few weeks. This will meet with the employer's responsibility to protect their staff and patients and also support the resilience of the health and care system. It's particularly important to ensure staff in vulnerable groups, such as Black, Asian and ethnic minority employees, are adequately protected this winter, and that appropriate risk assessments continue to be prioritised. It's going to be a challenging period of time, but it's also an opportunity to further demonstrate how community pharmacy can work in collaboration with general practices and deliver new and expanded NHS clinical services to the public. Equally important this winter, we must all remain vigilant and safe with regard to any second wave of COVID. We hope the situation will remain at the level of local lockdowns rather than a national one, but there is an important role here for LPCs. The country is relying on community pharmacies to be there for them, and to do that you will need to maintain rigorously your focus on infection prevention and control. We're doing all we can to support you to manage and be prepared. In this vein, I'd advise all LPCs to ask all pharmacies to sign up for the national PPE portal immediately as an important emergency supply route. Some changes have recently been made to support pharmacies being COVID secure, such as the move to verbal consent and the provision of some services remotely. We're currently working to introduce the ability for pharmacists to carry out video consultations from other premises, such as their own homes, and we think this will be another major step forward. LPCs will have a major role to play this autumn as we enter a new phase in the rollout of the network contract, DES, the Directed Enhanced Service, part of the GP contract. This year, the focus for PCNs is on enhancing health in care homes, early cancer diagnosis, and of course, structured medication review, or SMR, and medicines optimization. Right now, PCNs are recruiting hundreds more clinical pharmacists and pharmacy technicians to deliver the SMR and care home service requirements, backed up, of course, by the 18-month CPPE training pathway. This is great news for the profession, and I believe it will lead to a paradigm shift in which, as well as prescribing and dispensing medicines that are necessary, we're also agreeing with patients to stop medication when they are no longer needed, or offering alternatives to initiation to help maintain health. Community pharmacy teams are an integral part of this approach. The introduction of the medicines discharge service will see community pharmacy teams working clinically with their professional colleagues in hospital and PCNs to prevent harm associated with transfers of care. And the contractual framework is being developed at pace to make sure we implement other new referral pathways for PCNs that we have been testing through the pharmacy integration programme. National initiatives are complementary to this and will be developed alongside our PCN-led initiatives, especially Healthy Living Pharmacies and the PQS prevention programmes, particularly as the NHS addresses the urgent priority of health inequalities in primary care services. In the current PQS, we are focusing on encouraging and incentivising collaboration between pharmacies and general practices and establishing community pharmacies as integral to PCNs up and down the country, both in relation to flu vaccination uptake for patients aged 65 and over, and to both business continuity plans to help manage temporary closures during COVID. Finally, in the guidance to support the rollout of structured medication reviews in PCNs, we have made it a requirement that PCNs should work with community pharmacies to connect patients appropriately to the new medicine service, which supports adherence, as you know, to newly prescribed medicines. I'm going to talk now a little bit more about the clinical future for community pharmacy. We're pressing ahead with new developments to the NHS Community Pharmacist Consultation Service this autumn, following testing of the various referral pathways. In the guidance to support the rollout of SMRs, PCNs are asked to implement a referral process to access the Community Pharmacist Consultation Service for minor illnesses. Will be hugely helpful when we launch the GP referral to the Community Pharmacist Consultation Service across England from this autumn. The implementation will be supported by new developments from the Pharmacy Integration Programme, which we will share in due course. Both Ed Waller and I were very encouraged by progress made by the GP CPCS pilot in the Southwest region when we recently took part in a virtual visit which showcased the work of pharmacists and practices involved with the NHS England improvement and even LPC work. It's great to see that Richard Brown is sharing this with you at the conference today. This autumn, we also plan to pilot 3 further clinical services at pace. Those will be blood pressure testing, referral from hospital to community pharmacy for smoking cessation, and a new role in supplying stocks of end-of-life medicines for palliative care. And if these prove to be effective, we will introduce them across the country as soon as possible. To support this type of clinical future, the 4 UK Chief Pharmaceutical Officers have been working with the professional regulators, the RPS, statutory education bodies, higher education institutions, and of course employers, to accelerate the reform of initial education and training of the MPharm and the pre-reg year. We know that's badly needed to ensure a pipeline of pharmacists with the clinical skills that the public and the NHS. We have outlined a 5-year continuum of education that delivers increased clinical training across those 5 years, still with science underpinning everything, of course, and which replaces the pre-reg year with a 5th year clinical foundation training programme, including independent prescribing for all. I would expect these reforms to kick in quickly, and indeed we are aiming for the new programme to start for the first year students in summer 2021 and to see the first graduates from the foundation training year in summer of 2022. The new initial education and training standards will be gradually implemented for the current MPharm students once they are published by the GPHC later this year. We are already piloting a new foundation training year with the current provisionally registered pharmacists, and the learning from that will inform these changes. It's a particularly ambitious programme, but I think with a fair wind and a spirit of collaboration across the profession, we can make it happen, we can do it. But that leaves the existing workforce wondering, well, what about me? And I absolutely agree with that, and I would be asking the same. In England, thousands of community pharmacists and pharmacy technicians have already taken part in the pharmacy integration programmes, education and training schemes. We have learned from these developments and realised we need to go further and faster. Indeed, I'm currently working with colleagues to develop an educational framework that will enable existing pharmacists, at least those who want to accelerate their development to the same level of clinical competence. That framework is likely to mean a combination of credentialing an existing portfolio of training and experience, agreeing a personal development plan to get everyone up to the same level, including independent prescribing. I really want to see employers and the NHS work together on this. It's in everyone's interest. It will of course take some time to get everyone who wants to do it to get it through such a programme, and of course clinical service development must go hand in hand. However, the professional rewards for individual community pharmacists will be considerable, and importantly, patients and the public will benefit. I want to finish by touching on my work in partnership with all the national pharmacy organisations to develop more inclusive pharmacy professional practice. Like all of you, I've been shocked and chastened by the evidence of health and workplace inequalities. There's a lot of work going on within NHS England and improvement on this agenda, and nationally we're collaborating on developing inclusive professional practice to enable our profession to provide truly inclusive health and care services to the diverse population of England, and we'll be able to share more about that with you all in due course. This and all the other work that is underway means there is a very exciting and positive clinical future ahead for community pharmacy, whilst we also work through the many and very difficult challenges of COVID and the changes heralded in the 5-year deal to integrate community pharmacy with PCNs and expand their clinical patient services. Thank you all again for what you are doing, not just in your LPCs but beyond, to contribute to patient care and work constructively with the NHS, with PCNs, with LMCs, and with others. It's really appreciated. I hope you have a great conference. Please do contact your regional chief pharmacist, who is there as your point of contact to my team. Thank you.